process. And this slide, you can just do some practice for yourself. It gives you three scenarios. And remember what I told you about the differences between delirium and dementia. Delirium is an acute issue, whereas dementia is more chronic. Acute means it's happening now, whereas chronic means that it's been happening for a while and it just continues to progress. Um, and this gives you three scenarios, and it's just asking how a student would characterize things throughout these scenarios. So feel free. For instance, a 78-year-old male presents with new onset confusion in the physician's office. Keyword in this was new. New to me means this is a acute situation, um, and that we could possibly be dealing with delirium. So in my mind, I would go back and look at this patient's medication list because maybe there's a new med the patient was started on and this is how they're reacting. Or maybe the history of what might have happened in the last couple of days or weeks. I remember a man coming to our hospital through the ER and he was delirious. But what might have been his trigger for his delirium was that unfortunately his wife passed away and his children were the ones to tell him that, and he totally went off on his children. He just kind of snapped. He actually beat up his child, and he was trying to beat up the police too. So this was more of an acute issue for him. Whereas we're looking at the second scenario, the 65-year-old female has been having continued difficulty remembering phone numbers for several months. Several months is not an acute issue for me. That is more chronic and more progressive. Dementia only gets worse, it does not get better. So feel free to go through the last two and just what are your thoughts. Utilize the study group. If you're in study groups, kind of go through those two scenarios yourself and see how you might want to continue to have these two scenarios play out and what you think might be the issue, whether it's delirium or dementia. Thank you for listening to part two of the mental status assessment. And this concludes our PowerPoint.